skeleton. But we're doing something different. Nicole came up with a brand new idea that we're going to start doing a giveaway. And what we're trying to do is we're trying to get more people involved, get more questions. We get a ton of questions, and again, we apologize for anybody who we haven't answered your question. Keep trying, we'll definitely get you in. But we want to be able to do a giveaway. Whoever shares our Facebook videos the most gets a Michigan Sports and Spine mask. So we have our Athletes Unlimited masks that we always wear in the office because we're COVID protective. They've been great. A lot of people through my charity have gotten them, and they were such a good big hit that we got some from Michigan Sports and Spine too. So bottom line, whoever shares our videos and Facebooks and pushes it out to your friends, we're going to be giving out masks, and each week we're going to announce those winners. So that's my little tidbit for that. So getting into the questions, I mean, right now, things are still crazy. We've tried to give you a little bit of an update what's going on. I think the protocols, I think everybody's getting more confused than anything with COVID and what we should and shouldn't be doing. Again, our best bet, our best thing we can do is, like, if your family members have been positive, if you quarantine, there's a lot of questions. So what we're going to work on possibly for next week is actually looking to answer some of those questions. What's going on? Because from when we talk about the Trinity Health System or Beaumont Health System, they're pretty much giving a message: if you're not having symptoms, you shouldn't be testing. Where there's other messages being given: if your family member has been seen positive but you're asymptomatic, you still need to test. Can you go to work? Are you doing the spread? Is there tracing? So to be honest, I'm confused myself. So we might try to get somebody on. I know next week we're going to have Dhana on, who's one of my best therapists outside of Faith here in the office. That we used to work together on 97.1 The Ticket, answering questions. So we're excited about next week's show too. So getting into the questions for today, and I'm sure I'll sidetrack a couple times again. But the first question is something we talked about a while ago. It's called the text neck. So it's text neck. Is it a real thing? After working from home since March, I'm seriously starting to believe it's real, not just a millennial thing. So what that is everybody's on their phone all the time and your neck is down. So you're always looking down, you're always playing with some type of device, and your neck is bent forward. And it is a real thing. It absolutely is a real thing, meaning you're getting into a forward flex posture. So when you do that, your head is always down and you're creating poor mechanics for your back and your neck. And it can create spasms and irritation, and sometimes, we talk about manual movements of the spine itself, and that does happen. And what's happening is you're getting a forward flex posture that's creating, one, soreness in your neck, and two, you're having trouble, getting up in with your good posture. Like, yesterday I have one of my gymnasts who, when I deal with gymnasts, they usually have very good posture. And the kids naturally have a forward flex posture because they're playing on all these devices. And to be honest, my 3 kids are part of it too, my youngest. And right now, he's actually become more aware of it. It's funny because I've been bugging him for about 3 years on it. And now he's turned 13, 14 years of age. He's worried about his body, his posturing. So it's easier to work on. So to answer your question, number one, it's not just a millennial thing. It's someone who's working in bad workstations. So what I'm assuming is that you're not a millennial, the one who's asking me, and that you're someone that's a little bit older that's having to work at home at a poor workstation. We've talked about this multiple times. With us, everybody being forced to work at home, you have to develop a good workstation. So if it's a matter of, like, even with us, we put things on boxes, we try to elaborate, or, pretty much find a way to get it into good posture for us. Even with what I'm doing right now, it's not the best position, or I yell at Kate here in my office that she's young enough, she's young 20s, and she's able to kind of work in a weird workstation, which we're all being forced to do, but a long term, that's not going to be good. So what you need to do is recognize it, be aware of yourself, sometimes putting a mirror where your workstation is, so you do get that upright posture, kind of what I tell you to do at your workstations at work. is buy a little 6 inch by 6 inch mirror. Get into a good positional height, get everything right at your desk where you should be, and then put the mirror where it's visible off to the side and draw a line for your eyes, so your eyesight should be at that level. So when you're starting to fall below it, that something's wrong. And you usually want to get, it's a natural reminder to get you back up. So that's a suggestion that you can do there. So if you do have a text neck, what you need to do, if it's going on for more than 2 weeks where you're having pain, just stiffness in the neck, that's more mechanical, and you can kind of work with a massage or work with a therapist or work with your significant other to kind of massage that out, take some medication, use a massager, whatever you need to do, versus if you're starting to feel it down into the shoulders and down your arms especially, then that's where the nerve pain gets in, and obviously that's where we want to start seeing you or seeing someone like me, because you do not want that to continue to get worse. All right, so question 2. I've been taking gabapentin for post-herpetic neuralgia for 2 years. So just understand what that is. The post-herpetic neuralgia is like an irritation to the nerve, and it's usually through dermatomes. So it's different layers or different avenues or circuitry, to simplify it, in your system. So I don't know where it is. Gabapentin is a medication we use for nerve discomfort. It's otherwise called as Neurontin. So it says, how do I know if the medication has stopped working? I become tolerant to the current dose, or if my condition is actually worsening. My family doctor said it could be used in combination with painkillers, but I don't want that. What do you think, Dr. Pierce? So it's difficult. One is that it's going on for 2 years. Usually this is not a 2-year problem. There's usually sometimes even stronger medications that you need to deal with. If it is a medication like gabapentin, I'm not a big fan of gabapentin, because what we call the bioavailability. And what is that? What does bioavailability mean? It means the amount of medication that's can be delivered to your system. So bioavailability, you want a higher number. So if you're taking a pill, you want the bioavailability to be as close to as 100 as possible. What happens with Neurontin, as you increase the dose, like if you're at a dose, you can go up to 3,600 milligrams a day. Normal dosing is somewhere around 900 to 1,800. They say after 1,800, your bioavailability falls off greatly. So that's not a medication. People will go up higher because, one, most insurances cover it. It's not always the best medication. So when you keep going up and you're feeling like I become tolerant, or it's not working as well as I go up as it did before, there is a mechanism, what we call drug holidays, that you may need to take a break or switch medications. So you're not crazy. It's not unusual to feel that way with the medication, because you need to, I don't like going, my rule is 1,800. I don't know what your dose is, but usually after 1,800, that bioavailability drops off greatly. There's other medications like Lyrica and Cymbalta and other things like that. And then there's, taking a step back, is it something else going on? Is it truly just a post-herpetic neuralgia? And as there should be a dormant phase, so it should be decreasing on its own after a period of time. So you need to double check that that's the right diagnosis and nothing else is going on. And if it is the right diagnosis, there is a couple other medications you can use, either in combination with the Neurontin or the gabapentin, or switch from the gabapentin altogether. So that's something you need to be seen, and we need to talk to you, or talk to your family doctor, or maybe go to a specialist like ourselves to kind of get a second opinion. So moving along, question 3. Avid golfer, torn rotator cuff, told I need surgery. If I get surgery, how long is my rehab going to be, and can you tell me what the rehab would entail? Basically, want to know how long I'll be out of the game for I have a golf trip planned with my buddies. So this is a great, funny question that's so real. I have questions like this all the time. I don't want to have the procedure because I have this event coming up. And we get it. Look at the athletes. How many times, especially being in Detroit with the Red Wings, did you have Red Wings that you're like, what happened in the playoffs? What happened here? Why didn't he perform? And all of a sudden you hear about these surgeries. You put it off to the appropriate time. If you have a true rotator cuff tear, back in the day we used to say just let it go, build up the other muscles. The surgeries have gotten so good and well performed, and the rehab has been so specialized that we get great recoveries on this. It's not an overnight recovery. It's a good 4 to 6 months. That doesn't mean you don't do anything for the 4 to 6 months. But to be honest, with a rotator cuff, if you have a true repair that needs to be pinned or, pinned, what we call pinned or screws to reattach the ligaments, then you're out for a longer period of time. So to say, this is a very detailed question, I can't get into all of it until I actually see you, touch you, and know what your pre-existing conditions are. Are you in shape? Are you overweight? Are you strong? Are you used to working out? Are you disciplined? All those things play a factor. To just take from a physiological standpoint, if he has to drill into your bone and replace that, that's a 4 to 6 months from a physiological standpoint to get strong enough to really be hitting. Now, what I do with some of my avid golfers, like you say you are, I get you working on other parts of your game where you don't have that big windup, where you're doing the chip shots, you're playing the small games, you're putting, you're not hitting big drivers and things like that. So we work on other skill sets to keep your taste of the game still there. So what you want to do is, one, if it's torn, you need to repair it. The longer you wait, the more atrophy and disruption of that tendon, ligament, whatever is torn. If it continues to deteriorate and you lose that blood supply around it, that means the part of it, it's harder to rehab. So that's why you see, like I always say, look at what professional players are doing. Professional players don't wait for a rotator cuff to get repaired 2, 3, 4 months down the road. They're in surgery within a week or two. And a lot of times the only thing we hold off from is trying to get the swelling down and get some of the motion back. But it's always repair as quickly as possible. So if you're waiting and the trip is planned, I doubt you have a trip planned right now if you live in Michigan. But if it's like overseas or something like that, then you have to plan it out. But if you have a rotator cuff, to be honest, it's a good 3 to 4 months to do it, and that lasts, from month 3 to month 6, you're rehabbing it and you're kind of balancing activity along with the amount of therapy that you're doing. So hopefully that answers your question. Nicole always says, stop saying that, but it's my habit that I'm hoping that I answer your question, and now that you can't answer me, I'm assuming I did. So question 4, was in a car accident but didn't experience symptoms of neck injury until about a week later. To be honest, I let it go too long without seeking help. Started as some pain and stiffness, but now the pain is constant in my shoulders too. The internet says if left untreated, a small neck injury could cause long-term complications. What do I do? Where do I start? So again, this is another easy question for us. You start here. I hate to say this, short answer is you need to see someone like myself or come in here to see one of us. But that's so true. The internet's right. Hopefully you got that off of our website, because that's our message, is that the rule is 2 weeks. So the thing is, with the car accident, they always want you to say, what is your injuries right after? And when I was rear-ended, my symptoms didn't come out for about 3 to 4 weeks, because one, I was able to know what to do right away. And it's not unusual. Like a lot of these insurance companies that say, well, it wasn't related to the accident because it didn't happen right away, is not accurate. That's the immediate trauma. Most people who are motivated try not to, go to the emergency room, try to do those things, but inevitably it will build up on you. So number one, you need an aggressive treatment. I don't know when your car accident was, but if you're months, weeks out, you need to be seen like yesterday. That the quicker you get it taken care of, the quicker your healing process, the less damage you're going to do, the less compensating you're going to do. If it's going into your shoulders and it's not just in your neck now, that means it's starting to trail and you're compensating. If you're getting shooting pain, that numbness and tingling, that means there's becoming nerve involvement. So the classic car accident, we always know about the word whiplash. The whiplash is that quick movement of the segments of the vertebral bodies, the bony part of your spine, which will create a shearing, and that shearing will cause irritation to the joints and the ligaments around it. When that happens, it weakens the base, your infrastructure of your neck, and then it starts cascading, starts moving to the other parts of your body. And in this case, you could be compensating. So you need absolutely to get in. So what I said at the beginning, that this is an easy one, you need to be seen right away. So if you haven't been seen by anybody, I mean, I would be seen by a specialist in my field. You know, sometimes they're like, do I go to the chiropractor? Do I do this? To be honest, I mean, when it's getting into the shoulders and stuff like that, you can see a chiropractor, but you need to see someone who has a similar skill set and tools that we have here at Michigan Sports and Spine. I'm not saying you have to come here, I don't know where you live, but you have to come to someone that's non-surgical. Right now you show no surgical emergency signs, but that doesn't mean down the road you're going to get to that. And that's the other thing. It's like I have a lot of patients that we see that were on their second, third injury where I go, you know, this didn't happen over, you know, the last couple months. This is something that's happened over years. And that's because, oh yeah, I was in a car accident, I was in a sports injury, or I fell off a balcony and I injured my neck then, and it would hurt me for about 6 months, but then I was good. That right there is the very start of it. So if we can be more proactive off that first injury where you don't blow it off, where it's like, oh, I'll get better, I'm too busy right now. That's really what happens. So for the younger people, when you injure yourself early, you want to rehab it to the fullest, because when you're 20 years later, 30 years later, this is going to multiply. I mean, I just had a good friend who blew out his knee, but his initial injury was a sports injury when he played soccer, professional soccer. And, you know, years ago, they don't have the same skill set that we have now. And he's just had some silly injury that blew his knee out again. And now we're dealing with some major trauma that you know, the outcome is a little bit surprising, but it's all based because he had an injury prior. So that's why we talk about prevention. At Michigan Sports and Spine, we just don't like, oh, here it is, we fixed it. We talk about, you know, what caused it, what fixes it, what we're going to do, and what are we going to do to prevent it. Because I know historically and personally that these younger injuries accumulate over time. When you get a little osteophyte, or bone spurs is what we call it, because the body will self-heal. It doesn't self-heal perfectly, but when you get these osteophytes or bone spurs, like in your neck especially, it closes off the openings where the nerves are. So if I pull out my friendly spine again, we're talking about this is the front of you, this is the back, this is the bone, this is the disc, these are the nerves. Well, if you have a little whiplash, which are causing a real quick motion of the spine and pouncing back, you've irritated the ligaments that are here that you can't see. You irritate the bone. What the bone will do, it'll start a healing process, that cascade, and it'll remodel the bone. Well, if I remodel that bone incorrectly, it'll create a bone spur into these openings where the nerves are, and now this mechanical neck pain is turned into nerve pain. So, and then that leads to potential surgery or injections or something more involved. So it's very important to get treated, all injuries, even if it's like minor. You know, we like seeing minor injuries because then I can work on my prevention program real quickly. Like I told a young girl, she's 15 years old, she's a gymnast. I'm like, you're not the same person as the person next to you that you're training with. You have to take on extra precautions. You have to be, you know, core strong. You have to be more flexible. You have to be more diligent with your program. A lot of those people, when they're hurt early, especially with my hockey players, I always turned them on to something else to create that better infrastructure that you kind of take for granted as a kid. So having a young injury doesn't always say that, oh, you're messed up for the rest of your life. It sometimes leads to a better prevention program. So we try to draw the silver lining with every type of injury. Same thing here. And like I said last week, there's significant others that don't feel sorry for their spouses because they didn't take care of themselves early on in life. So that's the same thing here. You have to get treated early. The internet is right that it can lead to further complications. So you need to be aggressive with your treatment, and you need to find a place that's going to be aggressive. If you go to a physician and says, okay, do this and I'll see you in 4 weeks, that's not an aggressive way of treatment. That's a passive way of treatment. So here, I see you right away. We treat you like you got to be playing by Sunday. So next question. Hello, I'm a rheumatologist in the Metro Detroit area. I enjoy your show. How has COVID-19 affected your practice? Being a specialist, I'm sure you're experienced some limitations for what you can provide over telemedicine. Wondering how you've overcome these obstacles. So I'm not so sure this is a question that wanted to be answered here, but I'll answer it quickly. We've worked with a lot of different methods as far as telemedicine. Yes, we've absolutely are struggling with, because I do sports medicine. We do a lot of hands-on examination, which has been difficult. But the thing is, I don't know how many years you've been out in practice. We've seen a lot, so a lot of times I can tell if it's red flags or areas that I need to be more concerned with, or it just doesn't add up. Is it truly mechanical? Is it sports medicine? Is it nerve related? Or is it something more systemic, meaning it's something more like medically wrong? And usually we're able to screen that through the systems we have. As far as range of motion, obviously I can't do sensation. I trust the patient. I ask them to touch themselves, and if they're feeling the same, or getting more, I ask more questions in my history because I'm limited in my physical exam. Reflexes we're not going to be able to see, but you can kind of tell if there's atrophy or muscle wasting. I ask them to sometimes we'll ask them to even measure. We've done straight leg tests, we've done like axial loading, things like that mechanically that we've done. But overall, and then what we're doing, we're not 100% telemedicine. I don't know if you as the rheumatologist is 100%. We usually will screen them from that standpoint, and we're bringing people in. We're obviously being very selective who we're bringing in because we're concerned about that person, if there was some red flag or some abnormality that I couldn't figure out, and start treating them. And then we're probably ordering MRIs a little bit more because I can't get to, it's more on the symptoms. So we may be ordering a little bit more MRIs, but for the most part, I feel like we're doing a good job in an examination from the telemedicine, and then unfortunately, we're bringing them into the office if things aren't adding up. So we usually want to see that person, at least get a good baseline, and I think for the most part, it's become beneficial for both the patient and us, and we found a positive light, like most of us have found a positive light with the telemedicine. And in communicating this way, it's been, in some ways it's been great, in some ways it's a little frustrating, but I think we're getting through that frustration by bringing them in and just doing COVID precautions here. I think we have a better understanding of how to handle them in the office too. So far it's been going well. I'll be happy to, if you want to give me a call, I'll be happy to talk further on that offline, and give you any suggestions that I can come, that I have that you might be missing. So yeah, feel free to give me a call offline. But thanks for watching, and thanks for the nice words you've said. So question 6. So we're doing one extra question today, so we'll go quick. My mom had a bad fall earlier this year. I'm not sure her physical therapist is helping. How do you monitor progress and establish a time frame for recovery from a broken femur for a 74-year-old, 124 pounds who is considerably active before the fall? So we have, it's exciting because as I age, everybody else becomes younger. It's funny. But 74 isn't that, we don't consider that old anymore if you have an active lifestyle. Being in sports medicine and physical medicine, I get a lot of elderly, active individuals. So normally, a bone's going to feel better in 6 weeks, we want to say, but it's up to 6 months to where it's fully active and they're back to their normal activity. Physical therapy should be building up. There has to be a natural healing of the femur. I don't know if she had a rod put in, if she had plates put in or screws, but if it's a simple fracture, non-displaced fracture, you should be up and moving pretty good, and we move on a movement as tolerated type of situation. So that's a little bit harder, but if something's just not adding up, where it's like, hey, mom used to be very active, you want to be very proactive with that. You want to double check with a physician that you trust and a therapist you trust, because too many times have I seen where a hip fracture, you've heard the stories, they're true. You have this active lifestyle, and they fall, unfortunately, because of their poor balance. They fracture their hip and they're never the same. We need to be proactive. There's proactive ways of taking that on. Sometimes it's depression because of the lack of activity. Sometimes it's the balance, because it doesn't take a whole lot to knock the balance off from a person who's a little bit older. So you need to be very active in what's going on with their tactile stimulations, meaning like the floor surfaces, their balances, all that can be off, because right away when you have that hip fracture, you lose your muscle around your glute muscles, your butt muscles, and your thigh muscles, and you don't want it to drag down to your ankles and your calf muscles, because that whole cascade is just going to put you behind. And if it is, then you need a therapist to kind of, what we call turn the system back on, because once it's injured, the body's weird. It becomes very protective, and it'll shut down that muscle structure to be protective. And then sometimes it doesn't just turn back on by activity. Sometimes they change their gait, they walk differently, and all of a sudden you realize that you have atrophy of the hamstrings or the glutes or the thigh muscles, the quadriceps, which you're like supposedly back to normal, but you're not acting back to normal, and now you've changed your mechanics. So it's a great question, and unfortunately, too many people take it for granted. That's why, as a specialist, and that's what we really pride ourselves on, especially as Michigan Sports and Spine, is that we take it to the next level. Like, why is this not happening? You should be recovering. Like, I have another person. We all have time frames of what should be going on. So if this is definitely 4 months or more out, you need to be seen by a specialist. If you're within the first 2 months, things could be going a little bit slower. You need to reactivate. You may need to stimulate that muscle group so you become a little bit more proactive. So yeah, with these are the ones that scare me most of the time. So like I said, if it's over 6 months for sure. If it's over 4 months, I'm concerned. If you're in that first 2 months, you may just be a little bit impatient. But if it's anything over 6 months, you need to begin. I would say anything over 3 to 4 months, I would get into just double check and give everybody a sense of relief. But I will tell you that most of my colleagues will just blow it off and miss it, where at Sports and Spine, we take it to that next level. I want to know what's going on. I want to be proactive. I want to make sure everything gets back to its normal state prior, and a lot of times we make people even better. So I don't know why she fell, if her balance was a little off. I've always talked about my elderly people that we need to work on balance. There's always stuff we can be doing and making things better. So this has been a little bit longer, but in summary, for those working from home, we're all doing it. I'm doing it. My staff is doing it. I yelled at Kate yesterday that her posture, she's got great posture. You have to be aware of it. You have to be aware of your workstations. Don't just say this is temporary. It's not temporary. We're here for a good 3-6 more months of what we're currently doing. It may be a permanent change for a lot of companies that you're working from home. So spend the money on your workplace, because you're either gonna spend it up front or you're gonna spend it on medical bills on the back. Auto injuries, we specialize in it. We're comfortable with it. Whiplash injuries, you gotta be proactive. If you're injured, I don't care if you're in an accident that's very, very minor, you should still be checked out, because there's things that linger and show up later. Being proactive with all that is definitely the message, and it's exactly what we do at Michigan Sports and Spine, and to take you to the next level. Injury prevention is huge. For one, identifying it, if it's a simple thing. If we have to do cross training, if we have to do other things, like for the golfer, we can do work on other things while your rotator cuff muscle is being repaired. There's a lot of things you can do during that time frame. And monitor your progress. Always, if something's not adding up, the world's all about double checks. Make sure there's a double check system in place. Not all therapists are created equal, not all physicians. I ask patients all the time, let's get a second opinion, because I think I'm right, but I'm not 100% when you're not progressing the way I want. And you have to go to a physician that's comfortable with his skill level to say, you need another opinion. We need another set of eyes on this. I don't want to be missing anything. And to be honest, I'm honest with my patients that way, and I think they appreciate it, and I think we get better outcomes. And sometimes I have missed things. We're not perfect. So, and there's plenty of times I get a lot of patients here with second opinions, and we've had a few of them lately that have been big testimonials for us, where they've seen 3-4 other doctors, and we just have a different method, a different way of attacking it, and fortunately we're getting to where the outcome needs to be. So, I mean, we just wanna be proactive. It's all about you getting healthy. For those who are motivated, that's the people we love to have at Michigan Sports and Spine, and we want to push that ahead. So I've gone over, just real quick again, if you can share this with people. Nicole's going to be watching who's doing it. We're going to be doing giveaways of masks and other things, and we're going to be having special guests. We're looking for January to do other locations, like we talked about with going grocery shopping, cooking. I've already talked to a few friends with restaurants. We're going to be going to their restaurant and cooking for you, healthy meals. And then talking to our trainers and our therapists, we're going to their sites to see what they're doing different. And then I might even do a little walk with you and show you what you can do with a walk instead of just walking simply. We're going to talk to you about how I've put my mouth out there where you need to do lunges and all that. We might even do that if I get up to it. But we may have to wait till the springtime. So submit your questions. We're taking a poll. The quote of the week: a goal without a plan is just a wish. So you need to create execution. If I teach you anything, or you can take anything away, execute. Don't just be one of those people who can talk a good game. You gotta produce it. All right?